So, when you heard about the permanent teeth in 24-hour thing, what was your reaction?
I was like, is this really gonna last? What if they didn't work? So then I was gonna be left with nothing.
You had your teeth in, you're feeling great, but has anything gone wrong since these 3 years that you've had them?
There were things that happened, but it's not what you think.
Getting permanent teeth in 24 hours sounds amazing, right? But do they really stand the test of time? Ricky got his 24-hour teeth over 3 years ago, and today he's sharing the real story, how they feel and function now, what it actually takes to maintain them, and whether they're still worth it years later.
I want people to know what to expect when they go in.
So, Ricky, just to get started here, when did you actually have this procedure done? How long ago was it exactly?
It's actually over 3 years ago. It was on June the 16th, 2022. And I remember the date because you always remember those things that changed your life.
Absolutely. So, I do want to ask before we kind of dive further into it, why did you actually end up choosing this quick 24-hour process over the traditional dental implant process?
Well, Emily, I already had enough anxiety and I didn't like going to the dentist in the first place. And that's probably what got me one thing that got me into the situation that I was in. Whenever I talked with Nuvia and they showed me their procedure and everything, and it could be done in 24 hours instead of months and months and even, year that could lead into a year plus. That meant less time of me going to a place I didn't want to go. So, that was that was really important to me.
So, what actually happens at the 24-hour mark, though? Like, was it all they said it would be? Like, what are you actually getting in 24 hours? What does that look like?
So, whenever I went in the next day, I actually shot some videos and stuff of it, where I got up and I didn't have anything, and I was going in for the install of the prosthetic. The implants were already in, and they put those in the day before, and, I drove to Nuvia, and I get in there, and they were waiting for me. They were ready. They were prepared. They talked to me about how I felt. Everything was looking good. They looked at everything, how it was healing up, and then they installed the prosthetic. It was amazing how a little bitty thing could hold in this in your mouth, in your bone. And then after that, I was smiling and shedding a few tears and celebrating. So there was no pain on my end. There was no pain, no anything. And I was a little nervous because it was the, first time it happened and it was normal because of the dental anxiety that I'd had from past experiences. So
Wow. So, you had surgery one day, and then 24 hours later is when you got your teeth actually put in. So, I am curious though. You had your teeth in, you're feeling great, but were you still a little bit skeptical of the process? Were you kind of like, well, it did happen so fast, so were you maybe this won't last, maybe it's not of quality? What concerns did you have even after you got them in and you were excited?
I was excited. My biggest concerns um was that I was gonna do something wrong, because you don't know. All my years of research, nothing tells you. And that's what I love about your podcast and stuff is you're putting information out there so that people that get it done now, they don't have to. They're still going to have those anxieties and fears, but hopefully this lessens them. I can't say that I was too concerned about the quality because of how everybody treated me and they show you the whole process. It wasn't a guessing game at all. If you have questions, they answer them. My biggest thing was, even though the teeth I had were really bad and short from grinding and things like that, they were still my teeth. So my deal was, what if they didn't work after you pull out all my teeth, even though they weren't very good? And if it didn't work, what was I gonna do? 'Cause then I was gonna be left with nothing. And there was so much information, and this is just a little over short 3 years, 3+ years ago. Wasn't a lot of information out there. And Nuvia has worked really hard to get information to the public, which I would have probably felt a little better with back then, but there wasn't. So I was really nervous. What would I do if this didn't work? Because
Yeah.
you don't know.
Absolutely. That is a totally understandable fear, that I'm sure a lot of people have probably felt going into this process. So now that you are, over 3 years out, this concern that people have had, if it's done that fast, is it really quality? Will it actually fit me right? So 3 years later, Ricky, what do they feel like in your mouth? Do they feel right or do they feel fake? What is that experience?
Not 1 second have they ever felt fake. Are they like the teeth that I was born with? I I don't remember because I'm so used to these because my brain programmed and eating and speaking and living life every day. And what's funny about this is last night I asked that same question to my wife. I said, "So, how do you feel? Do you even think about my teeth in my mouth? Like, because they don't come out, they're in there permanently." And it was 24 hours. But I asked her, I said, "Hey, do you even think about, is it weird that I have these?" And she goes, "To be honest, I don't even think that they're not yours because of the way our lifestyle, and it's not like I'm removing them or anything like that. So, I'm just living life and I don't have to do anything special,
Wow.
you know? So, I've seen people with dentures. They'll take them out right there at the table. And this, it's like it's the next best thing to having your real teeth,
Wow.
so you don't think about it.
Is there any, like, pain or discomfort that you've had with it either, or
I can now, 3 plus years into this, it's kinda like breathing. Like, I don't think about breathing either. I eat what I want. I get up and speak in front of people. I've had many opportunities to travel and speak to people on different occasions, and I don't worry about it at all because now they're a part of me, so it's not like like this box. It's here and I have to get it and take stuff out and put the stuff back in and think to make it useful. These are just no different than my to me now, no different than my arm, my fingers, my ears for here, just no different because they're they're part of me now. So
and how long do you think it took for you to get to that point?
I still worry today because that's just natural, especially whenever you've had, and people should be able to relate to this, when you've had dental issues, the worrying probably never stops. As far as getting used to it, I would say within 17 days, I felt very comfortable talking and speaking and doing things. The eating was never an issue with me at all. I had to it's kind of a graduating thing. I started out with energy drinks, then mashed potatoes, then macaroni and cheese, then within 2 weeks I'm eating, stuffed salmon with spinach and stuff, and you just follow the rules and everything just comes in time. Time takes care of everything. Takes care of everything.
Well, you did mention eating, so I am curious, 3 years later, are you like, limited to certain foods, or what can you eat this far in?
I can eat anything. I love food. I'm a big steak guy. I probably have steak, and I don't need anybody commenting on cholesterol or anything like that. I probably have steak probably 4 to 5 times a week because I like steak. Um, I eat a lot of protein, eggs, and things like that just because I like to be healthy. But if I choose, I'll eat ice cream because I like ice cream. And these, they say you don't have feelings, but I don't know the difference anymore because most of my teeth were gone. One that I had were really bad. So, but everywhere else, you have feeling in your gums and your lips. And if you can see the prosthetic, it's not very thick at all. Like it doesn't really cover a lot, like a denture covers your whole palate. These hardly cover anything, and so you still have all your taste and feel and things. So the eating part, I eat whatever I want in those little I love pecans. And Bluebell just came out with a new ice cream today, and it's a pecan pie. So
No way.
I plan on making my way to the store and seeing if I can pick some of this up because, I love pecans. But I eat chips and queso. I'm in Texas. Chips and queso is like a staple here. So, I haven't really had any issues with eating anything at all. Actually, I've had no issues with eating anything at all. So, I don't let that and I don't think about it. I don't think, "Oh, is this gonna be difficult?" You know? Because I don't have to.
So they feel strong. They feel you're not
Oh,
worried.
they're really strong. I'm one of those people. I own a business, and I put my name on a lot of things. And for me, I look at it as this right here. Every time I smile, it's Nuvia's brand. So they're not gonna put something in my mouth that, they don't want other people to see with their name on it.
Right.
And but I was at a dentist the other day, on a job that we have, and we were doing a job at this dental office, and the dentist was in there, and I asked her, I said, "Hey, so what do you think about my teeth?" She goes, "You have an amazing smile." I said, "Well, they're implants." And, I told her, I got them done in 24 hours. She goes, "Oh, wow." And I said, "I've had them for over 3 years." And she's like, "Well, they look phenomenal." But most people, they have no clue that I wasn't born with these. I've had people tell me, "We just thought you took really good care of your teeth." And I don't go to a restaurant and have to ask, "Oh, well, do you got something like that's a level 7 on a hard scale that I can eat?" I just order what I want on the menu. So,
Wow.
and I enjoy it. And I don't fear. I don't think twice about it. And by the way, if any point in this video you want to find out what this can cost you, look at the link in the description below.
So you mentioned, taking care of your teeth. So I am curious, and I'm sure other people are. Is there a lot you have to do to upkeep these? And can you talk about that?
I did an awesome video on the upkeep of these, and, I had props because I like props. I had the toothpaste, the toothbrush, I had the water pick, and I had a tongue scraper, and I had the, uh, mouthwash. And the biggest thing is I use a non-alcoholic mouthwash that's good for your gums because now I want to take care of my gums. These are pretty dang tough. I don't really have to worry about that, but I wanna take care of my gums because that's what they're attached to, and, so I take really good care of my gums with the mouthwash, the toothbrush, the water pick, and it's a part of your overall health in your mouth, is keeping your mouth clean. So really, for me, there's not any more maintenance than what I would do if they were the teeth I was born with, because now they're a part of me.
Wow. All right. All right. Well, I now kind of want to go back to, if something is done this fast, 24 hours, you got your teeth. There's no way it can last, right? So, Ricky, has anything gone wrong since these last 3 years?
There were things that happen, which are normal. Once again, your anxiety takes over. As your mouth is changing, because it will, and that's why, you come in 24 hours later, you get these babies, and then they check on you. You'll have a 2-week check and then a 4-month check. Then you should go in regularly, maybe once a year, and have them look at them. A lot of people are concerned about what they call the gap. Once again, I've actually done a video on that too, because I want people to know. I want people to have the whole story. I want people to know what to expect when they go in. And at some of these things, it's not a big deal. Up here and down here, I have a gap between the prosthetic and the gum exactly, the gum tissue. It's not very big at all. Yes, whenever you're eating and stuff, just like your teeth, you got stuff in your teeth, you can get stuff in the gap. Guess what? It comes out. I don't have to do anything special. I don't have to get up from the restaurant and run to the bathroom and sit there and stick my face down under the faucet or nothing. Usually I just grab my water or my tea or whatever I might be drinking, and I take a drink, and I do that, and it removes whatever's up in there. That doesn't mean you shouldn't still floss and brush and things like that. You still need to do that. because you'll get tartar and stuff, just like on your regular teeth. You'll get buildup on them. As far as the gap, I researched it because that's what I do, unfortunately. And the gap has a lot of purposes there. The gap, it's like if I throwed a piece of cardboard out on my lawn, it's going to kill it. Okay. So your gums, I don't know what it would do, but it only makes sense to me that I don't want something setting right on top of my gums because I can't take care of that tissue. There's no blood flow to there. So that's a big thing of the water pick and brushing your gums also besides your prosthetic, but your gums is to keep them invigorated, to keep blood flow, to keep them healthy. If you just had something setting on there, you know, everything has a reason and a purpose. The gap doesn't bother me at all. Nobody can see it. I can smile really big, and you can't see it. The only person I tell people, I say, the only person gonna see that is me if I walk around with my doing this. But who does that? No one. If they do, you need to have a talk with them. The gap is actually no big deal, and it has a purpose, and it doesn't impede anything from me living life, from eating to smiling to speaking or anything. So
So, say after, surgery and someone's swelling is going down and they start to have that gap form, and maybe it's like too big to their preference or they're concerned about it or worried about it. What does Nuvia take care of that, or like what would you say to that?
I will say this: take a deep breath, relax, don't worry about it. Give yourself time because obviously, if it's like that, you're still not at your 4 month. Okay. Whenever you go in, have a list of things, whether it's the gap, how you want things to look, and talk to your Nuvia people about it. They'll take care of whatever. If your swelling is so much that whenever your mouth goes down, when the swelling goes down, dissipates, and it leaves a decent size, they can take care of that for you. So they're not just going to leave you out there. Keep living life. Whether it's 2 weeks, 3 months, 4 months, 3 years, don't worry about it because that's going to take away from why you're really here. You want people to be like, oh, wow, you have a beautiful smile. And whether you choose to tell them, yeah, their implants, they got them done at Nuvia in 24 hours, or whether you just choose to say, thank you and go on, that's up to you. That's a personal preference. I've actually done both and not missed any sleep at all over it. So
I love it. Well, what about when you've had to go back in for these appointments? You said 2 week, 4 month, or even when you were concerned about that gap that you did have. Did that cost anything extra, or has there since these 3 years have you go had to go in and pay anything unexpected?
no, everything's pretty much so far. It's all been all inclusive. They want you to be happy and satisfied. I own a business. Customer service are really important to me. Uh, I will say customer service to Nuvia is one of their top priorities. If I've had any questions even, I'll call them up or I'll send them a little message. You know, they answer me. They don't send me a bill later, whether I go in or whether I email or text or whatever. They don't I don't get an unexpected bill or anything like that. It's just part of customer service. And
Great.
you can't beat that because a lot of people miss that these days.
Absolutely, for sure. Well, it sounds like these teeth have, become a part of your life, like you had said earlier, something you don't really think about anymore. But I also am curious, has there been anything unexpected come from having these teeth for the 3 years? I know you've mentioned before, like you've seen some health changes, or do you want to kind of talk about that?
My teeth were so bad, I didn't break my food up very well. It was really hard for me to eat things, especially steak, where I thought I would choke. That causes issues. My teeth were so bad that they were actually releasing toxin or bacteria or whatever into my bloodstream. And every night I would get sick. And I've told this story before, and it they didn't know. They thought it could have been cancer or whatever, because they couldn't find it figured out. And someone said, "Hey, you think it could be your teeth?" I
Wow.
never thought about that. So I actually, once I got this done, the next day before they actually put the prosthetic in, I could feel my body healing, which may sound strange, but I could fit because I wasn't sick. I felt great. I wasn't nauseous. I wasn't like, oh my gosh, because it was
Wow.
every night. And I would just be in there on my knees, just sicker than a dog and didn't know why. Um, Afterwards, I could feel my body healing. I started eating, being able to chew things, being able to digest things properly. It made a big difference in everything, like the way that I thought about life, the way I wanted to look. And whenever you're smiling and you feel good about life, everything else changes. Your relationships change, not just your relationship with the people you live with, but who you deal with on a daily basis. Nobody likes that grumpy old guy, you know, or afraid to talk to you because maybe you weren't grumpy, but you didn't smile. You were like, you know, nobody wants that guy. Nobody wants to even approach him.
Right.
So, yeah, it changed a lot of things health wise, and your health has a lot to do, as I have found out, with your mental state and your emotional state. You know, you're much apt to take better care of the rest of you because this is an investment. And the thing that I figured out after many years of kicking it down the road and going to different places was that I'm worth it. I'm worth one day seeing, whenever my son ever decides to have children, seeing my grandchildren, seeing my friends' kids graduate. Who knows? Who knows what I would have missed? So, people are out there listening, you're worth it. You are worth it. The people around you are worth it, and they want you to be happy.
Absolutely. Well, Ricky, you kind of already answered this for me, but I do want to hear it. 3 years later, has this whole process been worth it?
Oh my gosh. Every day it's been worth it. It's been worth it to the fact that what makes it worth it is I don't have to think about it. I just get to live life. I'm not, and nothing against people who have dentures. My parents had dentures. My wife's dad had dentures. And as he got older, he'd take them out at the table and stuff. Um, Nothing against that. But you know what? I'm glad I'm not there because the biggest thing that's made this worth it is I don't have to think about it. I don't have to wonder, about what to do, how they feel, how they fit, how things taste. I just live life. And whenever you're free to live life, it's worth it. That's what makes it worth it.
I love that answer. I love that answer. Well, Ricky, if someone's wondering, something that sounds this amazing, there's no way I can afford it, right? That's probably in a lot of people's heads. So, where would you suggest they start to like maybe learn more information about this process?
Make sure you download the cost guide into the description. Just click on it and it'll pull up the cost guide and you answer some questions and you'll kind of have an idea. But as far as finances, they offer awesome finance plans. They'll work with you on what can we do to change your life.
Well, Ricky, thank you so much for sharing your experience today. It sounds like the 24-hour process isn't too good to be true. Don't forget to like and subscribe. And until next time,
Keep
keep
smiling.
smiling.